get 85% of that. And you remember 15% of that. You leave, and then we go off and live our little disconnected lives. And it all happens in 8 minutes. It's absurd, right? I mean, it's, been the same for the past 3,000 years. You live your life as your doctor, live your life as your, it's pretty obnoxious. For 77 years we do this, people. 77 years times 4 visits per year times 8-minute visits, that's about 0.0000456% of your life spent with your doctor. And 1 hour per week with your therapist, and you're still not sane. I mean, not even close. So docs are supposed to keep you well, right? Isn't that the point? I mean, but the biggest threat to our nation's health is bad behavior. Smoking, eating too much, sitting around, drinking too much. And docs are still the saviors for our health. I mean, with 32 minutes of time per year, so I was trained to write prescriptions. I wasn't trained to change your behavior. Other people do that. It's absurd. So how can we do our job well? Well, hot damn, I'm pretty excited. We're not paid to do our job well. We're only paid to do 2 things, and that's to bring you into the office and do a procedure on you. That's the only way I get paid. So that's called fee for service. So since we only get paid for visits, the effective and efficient doctors simply get paid less because we don't see you as much. For asthma, I get $200 if I prevent your asthma, but I get $10,000 to treat it. That's a good deal. So I need to see as many of you as possible. Nurses, techs, billers, receptionists, I had all these people to help me see as many of you as possible. I had 4.6 staff per me. That adds up to about 70% overhead. So the minutes, 8 minutes, 7 minutes, it goes down every year. When's it going to stop? Maybe I can add a computer. Well, they streamline things, right? I mean, that's what I heard. Nope. But not in healthcare at all. There's no real return on investment, actually. I'm seeing 40 patients a day normally. If I add some shiny computers, I can see 44. But then I have to pay $25,000 for those computers. And in order to pay for that, I have to see 50. So it's physically impossible for me to even use a computer. Computers help me lose money. So my time is the bottleneck, and that's all I get paid for. So 9% of primary care doctors use computers. That's it. That's why 16.3% of our gross domestic product runs on handwritten notes. And also because they give me applications that look like that. They're horrible. It takes a lot of money to collect money. The insurance companies have one, and we're using 3,000-year-old tools to deliver health care in the richest country in the world. Compare this to my practice. Well, I mean, the good thing is technology replaced staff. I used free applications. I could solve problems via email or iChat, so I didn't have to see you in the office all the time. I could see 8 patients a day, $200 a pop, 10% overhead. I was making a pretty good living. And you liked it because I was accessible. I was an old-fashioned doctor using today's tools to have a real relationship with you guys, to keep people well, to keep me happy too. I worked for myself, and I was free from the insurance companies. I was accessible for the uninsured, and I got to use computers because I like them a lot, just like you do. So I grew up on the internet. I have a Flickr account. I have a blog. I designed my own website. I'm fairly tech savvy, and so are the latest batch of doctors, because remember, they were born in 1982. I lived this revolution. I mean, I saw Napster come around. I saw Amazon. I mean, it streamlined everything. I saw Facebook change the way I interact with people. Who's revolutionizing healthcare? Is it the government, the insurance companies? That's pretty, no. Has anybody ever thought of like a top-down revolution? I really don't think so. It's sort of like Sears inventing eBay, right? So what if we reimagined healthcare? What if we upgraded those 3,000-year-old tools? What if we really started communicating with people? What if we built a web platform that was more like a social network to communicate you with your health team? I mean, we could get back our relationship. And this platform could allow doctors and patients to create profiles. They could make appointments online to meet in person. We could communicate, and we could transact. You could pay me via this platform. So that you're in the center, and you have all these specialists around you that you can communicate back and forth with. And your doctor can communicate with your nutritionist. And your allergist can communicate with your acupuncturist. And everybody's communicating, and the central figure is you. Imagine that. Well, I mean, that's how it works. You can talk to professionals can talk to you, and professionals can talk to one another. And I'm a doctor. I mean, I have time to sell. You're in need of my expertise, and there's 47 million uninsured people who are in need of my expertise, and there's a $250 billion market of out-of-pocket doctor expenses in America. There's 15 million people with high deductibles nowadays, and basically I'm just saying this because we've built this platform. It's called Hello Health. It's really exciting, guys. I mean, it's the internet. It's your local health professionals in their local office using today's communication to get easy access really when and how you want it. So what can you do on this platform? Well, you can create your profile. You can choose your own health team. You can see their ratings. You can see their fees. You can see their profile. You can communicate with people. You can use email, IM, video chat. You can make an appointment. You can rate your team. You can refill prescriptions. You can stay well, really. So what do you get as a member? Well, easy, accessible health care. And you get some peace of mind because you can always go to somebody because it's sort of like pinging your Facebook friend. It's access to distant professionals, and I'm going to get into this soon. It's really cool, though. And most importantly, it's affordable and efficient. It gets you what you need when you need it. So what can I do on this thing? Well, it's pretty cool. I can set my availability because all these new doctors